Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, treatment of carcinoma esophagus. So, how are you going to treat a case with carcinoma esophagus? Treatment of carcinoma esophagus will mainly depend upon the grade of the tumor. So, if the tumor is either high grade, that is carcinoma in situ, or T1A grade, in such cases, we should do an endoscopic mucosal resection is done in the patient. Now, if the tumor is actually a localized esophageal cancer, if it is a localized esophageal cancer belonging to T1, okay, if it is T1, then we can do a vagal sparing or transhiatal esophagectomy or minimal invasive esophagectomy can be done with limited lymph node dissection. If the treatment is of, if the tumor is of T2 and T3, if it is T2 and T3, then you should do a neoadjuvant chemoradiation with surgery is indicated. If it is T1, you do vagal sparing or transhiatal minimal invasive esophagectomy. You will only remove the esophagus related to that tumor only. That is, if this is the esophagus and this is the tumor, you will only remove the esophagus pertaining to the tumor with limited lymph node dissection. Whereas if the tumor is T2 and T3, you will do a surgery, you will remove the esophagus with the tumor, and also you do a neoadjuvant chemo radiation is also done. Now, if it is a cervical squamous cell carcinoma, or if it is a patient who is not ideal for resection, maybe an old age, maybe any reason due to which the patient cannot undergo surgery, in such cases definitive chemoradiation is indicated in these patients. Next, second, if the patient has an advanced cancer, locally advanced cancer, in cases of locally advanced cancer, chemoradiation can be done along with surgical resection in T4A. Chemoradiation is done along with surgical resection, especially in T4A, for a locally advanced cancer. If the patient has metastasis, distant metastasis, in such cases, you will have to do a definitive chemoradiation is done for involved distant lymph node, and for metastatic disease also we do a definitive chemoradiation is important. Now, if the patient has a malignant tracheoesophageal fistula, now you should clear the tracheoesophageal fistula. So in such cases you should put a self expanding metallic stents are recommended in malignant tracheoesophageal fistula. In malignant tracheoesophageal fistula, a self expanding metallic stents are recommended. Then, if the patient has gastroesophageal junction tumors, then post-operative chemoradiation is reserved for gastroesophageal junction tumors. For gastroesophageal junction tumors, post-operative chemoradiation can be done for these patients. Now, what is the extent of resection in the uh, esophagectomy? When you do an esophagectomy, if this is the tumor and you are doing an esophagectomy, you should make sure that the margin of the esophagus of around 10 centimeters margin should be removed while doing esophagectomy. So the goal of the tumor or extent of resection is in situ margin of 10 centimeters is the goal of resection in carcinoma esophagus.
thank you and thank you for watching.